we, as in the Arkansas Geriatric Education Collaborative, Cal's Library, and particularly my friend Karen Guthrie from the D. Brown Library, where we are today, want to thank each and every one of you for coming out and the people online for being here today. You are in for a real treat. We have been planning this for several months to get on Dr. Dillaha's schedule, and you are going to hear from Dr. Jennifer Dillaha. She is our Director and State Health Officer at the Arkansas Department of Health, and I've known her for several years, many, I won't even say how many years, both of us will tell our age if we tell how long we've known her, but she is an expert. She went to school in internal medicine, and then what else did you do, Jennifer?
I did infectious disease.
Infectious disease, absolutely.
And so, geriatric medicine.
And geriatrics, so, yay. All right, so we are going to not take up any more of your precious time, and we want to hear from Dr. Dillaha. She's going to give us a vaccine update, and lots of you have asked if there's going to be time for questions at the end, and absolutely, she is going to stick around and answer all of your questions about vaccinations. So take it away.
Oh, thank you.
May I just say, don't leave y'all after the presentation, because we've got a light lunch, and I've got handouts, and if anybody online wants them, just go to our Facebook page and ask for them.
Okay, thank you.
All right, so what time do you want me to end my?
It's totally up to you.
Okay. Well, thank you so much for having me. I think vaccines are the best thing since sliced bread, but a lot of people have questions about them, and so my goal today is to help you get the information you need to make your own decision about whether you or not you want the vaccines that I'm going to talk about. I'm going to start out by talking about the new RSV vaccine. It's the newest and probably the one least familiar to you. And then I'm going to talk a little bit about the COVID vaccines and then the flu vaccines, because we're entering what we're now calling respiratory virus season. We used to call it just flu season, but now that we have COVID around, and we've always had RSV around, that it's better just to kind of recognize that they all occur during the same time of year. So RSV, most of us are familiar with it with children. Little children can get really sick with RSV, but it's a very common infection, and children will get it, almost everyone gets it by the time they're 2. But we don't develop lasting immunity. Our immunity wanes over time so that we can get it again and again, depending on the level of our immunity at the time we're exposed. And for most people, it's a mild illness, and people get over it in a week or 2. But the older adults, say 50, 60 and older, are more likely to have severe illness if they get RSV. So if you look at all the adults who get it, it's going to be the older adults. Their immunity from having it in the past will have waned. And the severe cases cause them to have what they call lower respiratory disease, which is illness, infection deep down in the lungs. In fact, before this vaccine came out, we had RSV go through some offices where I work, and one of my coworkers who got it was rather ill from it. She said she felt like she was going to cough her lungs up. It was just a really severe cough. People who are older, especially people who are 65 and older, they're more likely to be in the hospital from RSV than other ages. And about 6,000 to 10,000 people are estimated to die from RSV every year in this age group. So it can be pretty deadly. There are certain medical conditions that people have that if they get RSV, they're more likely to have severe illness. It's very similar to the medical conditions that if you get flu or COVID, you're more likely to have a severe case. It includes people with lung disease or heart disease. Cerebral vascular disease like stroke, diabetes. People have kidney or liver disorders, or hematologic is blood disorders. And then, of course, people who are very frail. So that includes people who live in long-term care facilities, but it could be a frail person who lives at home. And of course, people at a very advanced age. As we age, our immune system goes through what we call senescence. Our immune system wanes over time, and we're not as able to respond as well to infections as we are when we're younger. And of course, anyone who has immunocompromised, a weakened immune system for any reason, whether it's medicine they're taking or if they're like being treated for cancer, or sometimes people inherit a condition that makes them immunocompromised. So just recently, the FDA approved 2 different vaccines for RSV, and they're approved and recommended by the CDC for people who are 60 years of age and older. One of them is made by a company called GSK, and it's called RSV. And the way I remember it's a little similar to saying the word RX. So it's RSV, right? And then another one is called Abrysvo, and this is made by Pfizer. I don't know why they make up these names the way they do, but it's not easy to pronounce them. The GSK vaccine is recommended for you to get 1 dose. It's adjuvanted, which means it has a component, a chemical in the vaccine, which stimulates the immune system to respond more vigorously to the vaccine. It's the same adjuvant that is in the shingles vaccine. Have y'all had the shingles vaccine? So the shingles vaccine, I have heard people say, oh, I felt fine after I got it, and the next day I felt terrible, and then the next day they were fine. So it's one that it doesn't last very long, but it can make you feel ill. And I imagine that the GSK, I haven't heard anyone yet who's taken it to tell me how it affected them. I got the shingles vaccine and I couldn't tell I'd gotten it. And I have had coworkers who got it after work one day, and the next day they came to work, and by the afternoon they felt so terrible they decided to go home. And then they were fine the next day. I guess that means the vaccine's working, right? And it doesn't give you the whole virus. It's called a recombinant vaccine. It just gives you a part of the virus that the immune system targets. So it's like showing the immune system a piece of the vaccine, of the virus, that your immune system, when it sees the whole virus, recognizes it and fights against it. The Pfizer vaccine is a 1-dose vaccine, and it also is a recombinant vaccine, which means it just shows you a piece of the virus, not the whole thing. And it does not have the adjuvant in it. And so I'm just going to talk to you a little bit about vaccines so that you understand that they're safe. Whenever a vaccine is developed, it goes through 3 stages of trial: phase 1, phase 2, and phase 3. A phase 1 trial, less than 100 people will get the vaccine. And the basic purpose of this is they're just trying to make sure it's safe to give to people. Before it can ever even do a phase 1 trial, they've tried it out in animals and done a lot of laboratory tests. But now they're just trying to make sure it's safe. And then if it finishes phase 1 okay, then what they do is they do a phase 2 trial. And they enroll people, maybe a couple of hundred people, and half the people get the vaccine and half the people get a placebo. And then they compare how well does the vaccine work? Does it really protect them? Along the way, they're still monitoring safety. Are people having adverse reactions to it? Is anything going wrong that they didn't anticipate? If that goes well, then they go to a phase 3 trial, which has a lot more people in it, may have a few thousand people in it. And they give half the people the vaccine, half the people get a placebo, and then they compare. Do more people who get the placebo get RSV infection? Does it protect them? if they get infected, do they have more severe illness? And those kinds, so they can compare how well the vaccine works. So for the GSK vaccine, they did that. They went through phase 1, phase 2. When they did their phase 3 trial, they set it up in such a way that even the researchers didn't know who got which vaccine. It's tracked by special numbers, but the people who got the vaccine, they don't know. So they can't influence the results by which one they think they got. They did it in a number of 17 different countries. They tested it in almost 25,000 people. And so in this vaccine, they got either the real vaccine or a saline, just, a little salt water in the shot. And they tested it in May 2021 through March 2023. So they went through 2 RSV seasons, because seasons in North America are usually about October through March. They found that the people who got the vaccine were almost 83% less likely to get RSV that first season, and 56% less likely to get RSV the second season. So it wanes over time, and they're doing studies to see, will people need another dose in the future? If you put all the seasons together, those 2 seasons, it was about 74-75% effective in preventing people from getting laboratory confirmed illness.
Excuse me.
Yep.
What's LRTD?
It's lower respiratory tract disease. It's the severe illness when the RSV goes down deep into the lungs.
Okay.
So then they looked at, all right, what kind of reactions did people have? So they have a way of measuring them, whether it's a mild reaction, a moderate reaction, or a severe reaction. And they looked at the severe reactions, how many people, and about 2.8% of the people who got the vaccine had a more severe reaction where they would feel sick. And very few people who got the placebo, less than 1%, 0.9%, had some kind of reaction. And then people who had adverse events where they had to go to a doctor, it was severe enough. It was 4.4 in the intervention group and 4.3 in the placebo group. So there really wasn't a difference. And it's likely that since they're the same, not much difference, they're going to the doctor for other reasons. And then the one thing of concern was that of all the trials, there were 3 people who reported, or the people didn't report it, the study people reported 3 people who had neurologic events, some kind of neurologic effect. But when they went back and looked at it, 2 of them were at one site, and one person died, but it wasn't because of the neurologic event they died of dementia. So they couldn't really tell, was this real or not? And so will play a factor in how they recommend it. Now I'm going to talk about the Pfizer vaccine. The Pfizer vaccine is very similar. They did their study in 7 different countries. They had well over 36,000 people participate who were 60 and older, and they randomized theirs 1-to-1. And so they half the people got the vaccine and half the people got what's in the vaccine, but without the part that stimulates the immune response. So they could compare. They were almost 89% effective if they compared the vaccine with the people who got the placebo, and it prevented laboratory confirmed lower respiratory tract disease about 89% of the time. So that means a few percentage are still getting ill, but it wouldn't be as severe. And then a lot of people got protected completely for that first year. The second year, it was a little over 78%. And so over the 2 seasons, it was about 84% of the people being protected from getting that lower respiratory tract illness. In this trial, they looked at how safe it was. About 1% in the intervention group had a reaction to the vaccine that was severe. The adverse events were about the same in the people who got the vaccine and the people who got the placebo. But they also had 3 inflammatory neurologic events in all their studies. And it's not really clear whether the vaccine caused them or not. So what they have done is, because of these inflammatory events, when you think of all the thousands of people who got them, it's pretty low. But sometimes a rare problem won't show up in the trials because you'll need, if it's something that occurs once every, about say 5 people in a million, it won't show up in the vaccine trial. So after the vaccine's marketed, they continue to monitor the safety to see if anything shows up. And so for this reason, they said that the older adults who should be targets are the people most likely to benefit from the vaccine. The people who have those health conditions that are make them more likely to have severe illness. Those are the people who really need the vaccine. And that's who it should be targeted to. So they want people to talk with their doctor to see if the doctor feels they would really benefit from this vaccine. Over time, they may, if the neurologic problems that developed in the trials show that they're not real, it wasn't really the vaccine, then they may broaden the recommendation for everyone 60 and older, but that's not where we are yet. Right now, they want the people who are at the highest risk to be the ones that get the vaccine, because the highest risk would be people with heart disease, lung disease, diabetes, all those things I mentioned, because the benefit they would receive would greatly outweigh the risk of taking the vaccine.
Can I ask,
yes.
what do you actually mean by inflammatory neurological event?
So, yes, I'll repeat it. So she's asking, what do I mean by inflammatory neurologic event? And so Guillain-Barré is an example of one. Another one would be let me back up here and I'll tell you what the one was in the GSK. It was an encephalomyelitis, so an inflammation of the brain. All right. So the official recommendation for this vaccine, for this RSV season, is that doctors should offer it, or it could be a pharmacist should offer the RSV vaccine to people who are 60 years of age and older, sharing a decision with them about the risks and the benefits, and that they should continue to offer it as long as the people remain unvaccinated. Because we want the people at the highest risk for severe illness to be the ones to receive this vaccine in the target group. Does that help? All right. And so right now, it's just recommended for a single dose. In the future, it might be recommended to give another dose. They're doing the studies over the long haul to see if that would be really helpful. You can get this with other vaccines, but since this is a new vaccine And as I mentioned, there might be rare side effects out there that we haven't seen in the clinical trials. I think I'll say no to this. Do you want to consider that?
Sure. I don't know why it's asking you anything.
Yes.
What about people with breathing problems on breathing machines?
Yes, those people would be at high risk because if they got RSV, it would make their problems for breathing even worse. Okay, so I want people to know that there's a way for everyone to report a vaccine adverse event. It's called the Vaccine Adverse Event Reporting System, VAERS, we call it for short. And you can do it online or you can call the health department. We have someone who will help you. But this is a way for us to capture anything that the vaccine might cause that's bad, that didn't show up in the vaccine trials. But we might want to know, maybe you aren't sure. Even if you're not sure, you can report it, right? Because then they'll go and look into it and see. And if they get an idea that from these events that it might be causing a certain kind of problem, say Guillain-Barré, which is a nerve condition, it weakens your muscles and your ability to move. They can go to other sources to see if it holds true in the way they do their studies. I'm going to skip that one. And now I'm going to talk about the new COVID vaccines, just briefly. And then I'm going to talk about flu vaccines. So the current recommendations are for people 6 months and older to get a COVID vaccine. But since we're talking about adult vaccines, I just am talking about the ones that include the older adults. So I'm going to talk about the Spikevax and which is the Moderna vaccine, the Comirnaty, which is the Pfizer vaccine, and the Novavax vaccine. All three of them are approved for older adults, or for all adults 12 and older. So if a person is thinking about getting vaccinated against COVID and they haven't been vaccinated before, then you only need one dose if you get Spikevax or Comirnaty. If you would like to get the Novavax vaccine and you haven't been vaccinated before, then you'll need 2 doses. And those doses should be 3 to 8 weeks apart. If you've had vaccines in the past, either the Spikevax or the Comirnaty, or you've had Novavax in the past, or some people had the Janssen vaccine, which is no longer available, then you just need 1 dose of any of those 3 vaccines that are currently available. If you're immunocompromised, then you're going to need a few more doses to help your immune system respond more vigorously to the vaccine. So if you haven't been vaccinated before, then you would need 3 doses of the Spikevax, or 3 doses of the Comirnaty, or 2 doses of the Novavax. If you have been vaccinated before, it varies with how many doses you'll need and what the separation is between doses based on what you got before. So a nurse or a doctor or a pharmacist can help you determine what you would need. And this is for people who have weakened immune systems. And then for the flu vaccines, everyone 6 months of age and older is recommended to get flu vaccine. But there are 3 that are especially recommended for people who are 65 and older. There's one called Fluad, and there's one called Flublock, and one called Fluzone High Dose. And all of them are recommended for people who are 65 and older because they have been shown to be better than the regular standard dose vaccines. And you can't really say which one of these is better than the other. They're all three equally recommended. They haven't done head-to-head comparisons to be able to say one works better than the other. The flu block gets confusing to people because it's actually recommended for people who are 18 and older. But the Fluad and Fluzone are only recommended for people who are 65 and older. So I'm going to stop now and answer questions because I feel that if you can answer your particular questions, then you can make a decision that's best for you. So let me see. Do you have a question?
Yes, if you go back to the page just before where you are with your name, for under the for the flu shots, the first one, the Fluad quadrivalent, is the adjuvanted.
Yes.
That's the one that sometimes you get the short-term immediate reaction to it.
Yes. So the question is about the adjuvanted vaccine. Is this the one that you're more likely to have a reaction to? Yes, an adjuvanted vaccine, because as we get older, our immune systems don't respond to vaccines as well as when we're younger. So they have an adjuvant, which is a chemical they include in with the vaccine that is able to stimulate the immune system to respond more vigorously to the vaccine, what's in the vaccine that trains your immune system. And so the adjuvants are more likely to cause side effects, like some people will have a fever or body aches or just not feeling well the next day. Usually will last no more than 24 hours. It might last a little longer. But I guess you could say if you have that reaction, it's working. It's similar to people who've had the shingles vaccine. That has an adjuvant, and that one RSV vaccine has an adjuvant in it. And since it stimulates the immune response, people feel like they're coming down with something, and it just lasts about a day or so.
So does that mean that the third one, the Fluzone, is not adjuvanted? So would it generally have less of an immune response immediately?
It's hard to say. In general, adjuvanted vaccines, you may feel it the next day. I've had adjuvanted vaccines myself. I'm over 65. I can't tell I got them. So it just depends on the person. Some people think since the high-dose vaccine is high dose, it's going to be better than the others because they have a normal dose. But the flu block also, I didn't put that in there because it's not part of the name. It's also adjuvanted. So you don't need as much of what they call the antigen, the part of the vaccine that trains the immune system. You don't need as much since it's adjuvanted. So they're all equally recommended.
So what if you always have a bad reaction? I'm one of those people that
Okay.
does.
What if you always have a bad reaction to the flu vaccine? Anyone? Well, if you work, I recommend you get it on Friday. But people who anticipate that they may have a strong reaction, because it's hard to predict. You might think more people will have it than for a certain vaccine than other people, but you can't really say this person will or that person won't, So I think the best thing to do is take some Tylenol afterwards and just be aware that that's something that will...
I wonder which one you'd advise. I'm an old paediatric nurse retired, so we had flu vaccines every single year to work at children's.
Mm-hmm.
And I always felt bad, and I always did it at the end of the shift.
Yeah.
But because I have such bad reaction too to the COVID shots, having had COVID back in 2020, to be honest, last year I didn't have a flu shot because I felt so bad. I just had my COVID shot and again had a bad reaction.
Yeah.
So which one would you choose later in the year?
Just for the people online, someone's asking, which would you choose if you tend to have strong reactions to the vaccines? Well, in my capacity, I can't really recommend one over the other, but I can tell you I got the flu block.
Which has got the adjuvant
But
Is that a less strong dose?
it's what we call a recombinant vaccine. So it doesn't have the whole virus in it, the whole killed virus. It has a protein component of the flu virus that trains your immune system. So I can tell you that that's what I got.
I've never had the one for the over 65 because I've always had a bad reaction to the regular, so I've only had regular ones before.
I don't think these are more likely to give you a bad reaction than the others.
It just seems like since I had COVID, everything went into overdrive with any kind of shot. It's just crazy.
That may wane over time.
I hope so.
I do too. Yes, there's a question back here.
I had 2 COVID shots and 1 booster because my left arm would hurt so bad it just wake me up at night. So would you just recommend that I check with my doctor before I get any of the other shots?
Well, let me just put it this way. Yes. This person's asking about should they just talk with their doctor if their arm hurts really bad after they get the COVID vaccine. It's kind of a trade-off, right? Right now in Arkansas, 83% of the deaths from COVID since the first of the year are people who are 65 and older. So do you want to take that risk of getting COVID, or do you want to avoid a sore arm? That's a hard decision because it can make you feel miserable for a while. The new COVID vaccines are not technically a booster in the sense that they're just giving you what you had before and boosting the immune response. They're reformulated to better match the Omicron variants that are circulating right now. So you're more likely to either avoid getting COVID, or if you do get COVID, even though you've had the vaccine, you're more likely to stay out of the hospital. So that's a thing, that you have to kind of weigh out is decreasing your risk of ending up in the hospital or ending up in the group that doesn't survive. Is that worth it to you? Is it more important to you to avoid having a sore arm for, I don't know how long it lasted, a couple of days?
No, mine still hurts off and on.
It does? Okay. So you have to weigh that out. Other questions? Yes?
Can you get the flu and the COVID shot on the same day, or should you wait a bit between those shots?
So the question is, should you get flu and COVID shots on the same day, or should you wait? And so it's kind of a question, if you have reactions, do you want to feel terrible twice, or do you want to just do it once? Partly it's, I would encourage you to get them in separate arms. And people say, well, can you get the RSV, all 3 at the same time? Yes, you can. You just have to have 2 in one arm, and they have to be separated by at least an inch. But since the RSV is new and you haven't had it before, perhaps, you might want to get that one separate. And since it's got that adjuvant in it, or you could get the flu ad and the RSV at the same time and get both the adjuvants, and then you just feel sick at once instead of separate. Or maybe you won't feel them at all. See, it's really hard to weigh that out because you don't know if you'll have a strong reaction to it or not.
What about people that have had long COVID on vaccinations?
So the question is about the people who've had long COVID. and the recommendations for vaccinations. Well, we're still learning a lot about long COVID. Some people who've had long COVID report improvement after getting a COVID vaccine. Other people, it doesn't seem to help them. I think, though, if I had long COVID, I would not want to get COVID again. So I would probably get the vaccine.
I wonder, in England, my niece actually had long COVID. She had COVID twice, then turned around and got mono, and now she really has debilitating disease from that. And she says this year she's not going to take it. But who knows whether that's a good thing or a bad thing.
So this lady here, for people online, were saying that she has a niece in England who has long COVID. She had COVID twice, and then she got mononucleosis, which is the Epstein-Barr virus. And what they're finding is that people who get COVID have reactivation of Epstein-Barr virus. That can occur. So, and her niece has decided not to get the vaccine. My thought is, if I were in her shoes, I would get the vaccine because I sure wouldn't want it again. And so, there's a question over here? Yes.
Often when you're ready for your vaccine, they ask you if you're ill or if you're feeling sick. But if that's your chronic disease, how do you judge that?
Yes. So, when you go to, the question is about when you go to get your vaccine, they have these screening questions. And they want to know if you're feeling ill that day. How do you answer that if you have a chronic illness? What they're really looking for is an acute, moderate to severe illness. People who are moderately to severely ill should not get vaccinated that day.
Okay.
And so just if it's your baseline, I would say no. Yes?
I'm curious, is there anything that we can drink or eat that has an effect on the virus, the vaccine rather?
Okay, someone is saying that is there anything you can eat or drink that has an effect on the vaccine?
Yes, positive or negative.
So some people say drinking alcohol in close proximity to vaccination is not a good idea because it dampens the immune response. That's the only thing that I'm aware of. Of course, you want to take care of yourself and make sure you're well hydrated, and that some people, when they get a vaccine, and it's just the act of getting a shot, it's not what's in it, they tend to get kind of woozy and they need to sit down. Of course, with the COVID vaccines, they want to observe people because of the allergic reactions that people can have. So I encourage you, don't go on an empty stomach, and make sure that you're well hydrated. You're not down on your water supply for the day. There's a question in the back.
Yes, when COVID first came out, I was tested for it, and I was told that I had it, but I didn't have any symptoms or anything. Why is that? I mean, they told me to stay in for 18 days.
Yeah.
And I didn't have any symptoms or anything.
That is the hard thing about respiratory viruses, because you can have it in your tract and it's replicating, but it's not enough to make you feel sick. And that's why you have to do a placebo-controlled trial for vaccines to make sure they work. Because some people who get the vaccine you won't know if it prevented it unless you tested it against people who didn't get the vaccine. Do you see what I'm saying? And that's the same thing with the treatments. They have some really good treatments out for COVID-19, and people may have just mild illness and they take the treatment and they think, oh, the treatment worked. Well, it might not have done anything. They just had mild illness. So
I got it from this lady that I was taking to the doctor. She didn't know she had it, but when she got to the doctor, she was running a temp. and they would not let her come all the way in. And I took her back home, but that night they had to rush her to the hospital. I mean,
Yeah, so she's talking about taking someone to the doctor who didn't know they had COVID, and when she went to the doctor, they found she had a temperature, you know. And so that's the thing. Sometimes you don't know because in the beginning, you won't have many symptoms. And it takes a few days for the immune system to kick in. And it's when the immune system kicks in and starts fighting the virus that you really feel the symptoms, right? The side of this, the immune system fighting. But that takes a few days. And if the immune system is not able to contain the infection, you may progress to severe illness. So in the beginning, you might think, oh, I'm just having an asymptomatic case, not knowing that in a few days you're going to feel really sick. But some people, their immune system does a good enough job of fighting that virus that they're able to have either no symptoms or very mild symptoms. And in a sense, that's what the vaccines are designed to do. They're designed, because our humans do not develop lasting immunity to COVID or flu or RSV. You can get them again and again as your immune system wanes. So the idea of the vaccine is to train your body to fight the vaccine so that if you get infected, it contains it and you don't end up so severely ill, you end up in the hospital or you end up dying from it. But it doesn't always prevent people from getting infected. It helps. The real work of the vaccines is to limit the infection. There's a gentleman back there.
Okay, that was about, you got on to my question. My question was, I've had 2 vaccines for COVID, but I've had the boost. What's the lifespan of them? I mean, how long do it last? Do I have to go back every year, every 6 months and get another shot? Because it seems like they keep coming out with this shot, a new shot, a new shot. I mean, if it set up our immune system in our body, then shouldn't it be still immune in the body, or should we have to keep going back and getting shots?
Okay, I'm just going to paraphrase what you said. So this gentleman's asking about why do we keep needing boosters if it trains our immune system to fight the illness? Okay, there's 2 things going on here. So there's 2 main arms to the immune system, okay? One of them is antibodies, which are proteins that circulate in the blood, and they attach to the virus and block it and keep it from being able to hook onto one of our cells and get in, okay? So that's what the antibodies do. Now, there's another part of the immune system, which is we call the cellular immune system. And it fights the virus once it's gotten into one of our cells and starts to multiply, because viruses multiply by taking over the machinery in your cell to make more of itself. And then it bursts out and it goes to other cells and infects them. So the cellular part of our immunity helps prevent the spread of that virus once it's in cells by actually killing those cells. So it works, so it contains the infection once it occurs. The antibody part, we don't keep those high levels of antibodies forever. They'll go down over time. So someone who's had a vaccine, it ramps up those antibodies, but over time they go down. And it varies from person to person about how quickly they go down and whatever else has happened in their immune system. Some of the thoughts that it's about 6 months, maybe a little bit less, maybe a little bit more. But you keep that cellular immunity. So if you do get infected, that cellular immunity ramps up to fight the infection and keep it from spreading. It takes a little time for it to ramp up, so some people can get pretty sick in the meantime. So that's the benefit of getting the vaccine. Now, over time, we'll know what's the best timing. Do people who are older or people who are younger but have chronic health problems, should they get the vaccine a little more often to ramp up their antibodies periodically to help protect them from infection or not? Those are studies that are ongoing right now. It could be that COVID will become more of a wintertime illness. Right now, it's more all year round. But flu, our immune response to the flu vaccine is enough to last pretty much through the whole flu season. We still have flu circulating in the summer, but not very much. And that's when it's important. It's not as important to get the vaccine for summertime flu because of what happens in the wintertime. And the same thing about RSV. RSV is a wintertime illness. So if you get vaccinated right before the wintertime illnesses take off and start spreading it, and a lot of times it starts spreading when school starts because it's those kids that are really good spreaders of those respiratory illnesses. And so if you get your RSV and your flu shot before that wintertime illness, we're still trying to learn. We still have a lot to learn about COVID and the immune response, but so far, this new vaccine is protected, and if you can get it now before the winter season. The last few years we've had big spikes during the winter. We had some spikes during the summers in the past too. But, and I'm one that I don't have I don't have side effects from the COVID vaccine that I've had. So I don't mind getting it. Now this lady here who's had some side effects, you'll have to weigh out with your doctor what is the best strategy over time, as we know how long the vaccine's protection is going to be there in terms of infection. But as I want to emphasize, the best benefit of the vaccine is from hospitalization and death, because we know it can't always prevent people from getting infected. Does that help?
Is there a home test for RSV, like the home test we do for COVID?
Oh, this person asked whether there's a home test for RSV like the one we have for COVID. I'm not aware of one at this time, and let me talk about that a little bit. As I mentioned, people can get RSV throughout their life. So whenever they get infected, they have some pre-existing immunity to help them fight it, right? Little kids, they don't have so much immunity. So pediatricians have used a in-the-office kit that could be adapted for home. And it worked really well. This kid has RSV. It didn't work well for adults because the pre-existing immunity would block the test and you would get what we call a false negative. But the last few years, there's been so much work done on testing for COVID. They're now working on it for other things. We also, because of these innovations, they're now, like you do a COVID test, a PCR test, you have to go to the doctor or the pharmacy for, or clinic for, and they take the nasal swab and then they can do it. What they're looking for in those tests is the genetic material that tells you that they have COVID. Well, now, at least at the health department, last year, they combined that test with the test for influenza A or influenza B. And so they could tell you if you had flu or COVID. Before then, they could only tell you whether you had flu or not. If you had, before it was COVID. And they couldn't tell you, if you had you had symptoms, you were negative for COVID. Well, what was it? You don't know. They couldn't tell you whether it was flu or not. Now that we're getting ready to add RSV. So just one test and they can tell you if you have flu A or flu B. It's just two different types of flu. COVID or RSV. And that's helpful because if you had flu and you knew it, you could take the Tamiflu. You could take an antiviral medication to limit the severity of the flu. Same thing with COVID. If you knew you had COVID, you could potentially take Paxlovid. We don't have anything for RSV yet, but I'm hoping they will because it's really not any fun. I can remember when I was in my 30s, I had young children who got RSV and then I got it. And oh man, it was really, really rough for a few weeks. So, if I could take something to limit the severity of that, I would.
A question, if you have a reaction every time, does it mean that your immune system is hyped up then? For example, even though I now have Pfizer instead of Moderna, I still get the red arm, I still get all the nasal symptoms, the joint aches, but the arm thing, will the red arm come forever? Every year I do my shot?
So this lady's asking about getting the vaccines. She always gets a red arm and she gets respiratory symptoms and the joint aches and things. And will that happen every time? I just don't know. I don't have a good answer for that.
Does it mean my immune system is hyped up? Because within the hour, I actually couldn't breathe through my nose and I had to sniff eucalyptus.
Yeah, so she wants to know if it means the immune system is hyped up. It could be. I don't know that it means your immune system's going to respond better to the vaccine than someone who doesn't have those reactions. I think it's just unique to you. There was someone in the back there?
Yes. This COVID just came in here a few years back. Is this something that we're going to continue to look forward to and wear masks all the time, like, a continual thing?
So the question is, this new coronavirus illness is relatively new to the human family, shall we say. Is this something that we're going to have continually and we'll have to consider masking and so forth? Yes. It doesn't look like COVID is going away anytime soon. It's very common. I'm hoping that it will become milder. People may not realize that there are already 4 other coronaviruses that circulate among humans, and they cause about 40% or so of the common colds. And it could be that eventually this one will be like those. We'll just have to study it and follow. I think we have learned a lot about preventing respiratory illnesses and how important it is. How if you're sick, you should stay home. If you are going to visit someone who's at risk for severe illness, you might want to consider testing yourself before you go. If you yourself are at high risk, you might want to consider wearing a mask when you're in certain situations. I think these are all things you can use to lower the spread of respiratory illness, whether it's COVID or flu or RSV. Back to Matt.
I had been told that getting chilled, don't go outside, it's raining, you'll catch a cold. If that's not correct. But it seems like we have these certain winter diseases, and we surely have more colds in the winter than we do
Why is that?
So the question is, she was told, growing up that don't go out and get cold. When you get chilled, you're more vulnerable to viruses. I don't know that has really held up to the test of time, but we do see respiratory viruses circulating more often in the wintertime. I think it's probably multifactorial. I think it's because school is in session and kids are passing it around and they bring it home. And several years ago in Japan, they put in a regulation that all school children had to be vaccinated against flu. And when they did that, the death rate for flu for the elderly went down, even though they weren't the ones getting the vaccine. But families didn't like their kids having to get the flu, so they did away with that requirement, and the death rate among the elderly dying of the flu went back up. So I think that's part of it, is schools in session. I think part of it too is we're indoors more when it's wintertime and it's colder and it's yucky outside. One thing that the COVID pandemic has helped us learn about is the importance of good ventilation systems in facilities. So a lot of facilities are making changes to improve their ventilation system. Like at my church, they put in a UV light through the air handling, so it could kill organisms or viruses and so forth that go through the air. But there's other things that people can do in their homes or in their workplaces or in the schools. There's lots of work being done in schools. I think that's part of it too. And then I think part of it is that certain illnesses have a seasonality, and I'm not sure we really completely understand why that is.
I have a question.
Yes?
What can we do to strengthen our immune system?
What can you do to strengthen your immune system? Mm-hmm. Okay, so that's a very good question. To avoid infection with flu or RSV or COVID, if you're exposed, you have to have pre-existing immunity. But there are things you can do that would strengthen your immune system so that whatever immunity it has, it can respond well. And a lot of it revolves around maintaining your health overall. One is to take care of your chronic conditions, like diabetes. If someone has diabetes and their diabetes and sugar is out of control, then they will not be able to respond well. It weakens the immune system. And there's other chronic conditions that are like that. That's just an example. The other thing is to eat healthy. We know that I mentioned alcohol. Well, sugar and all kinds of other things do things that make our bodies less able to respond to whatever they're exposed to. And there are certain vitamins that are thought to strengthen the immune system. So making sure you work with your doctor on whether you should take a multivitamin or other supplements. There's all kinds of claims out there, and you can waste a lot of money doing those things. But talk with your doctor or your pharmacist about what does the evidence show, because if you do something, you want to know if there's evidence behind it, because it's more likely to work than if there's no evidence behind it, right? So, go ahead.
What about natural herbs?
One of the problems that we have with natural herbs is we don't know if they work well or not because they don't get studied. And you can spend a lot of money working, buying these things, and you don't know if they're helping or not. And the other thing that's important to know is some natural herbs interact with medicine. So you need to know which herbs your doctor needs to know, and or your pharmacist needs to know which herbs you're taking. It's very tempting to think if something's natural, then it's going to boost the immune system because, of course, we want natural immunity. Well, sometimes natural immunity isn't enough to keep people from dying. The infections are all natural, right? We get them naturally, but if we want to depend solely on the natural immune system, that doesn't always work, and that's why we want vaccines, because sometimes immunity that we get naturally is not enough. There are some illnesses that if you get them and you survive them, you'll be immune for life, like measles, right? The problem is you have to survive long enough to be able to get to that point, and some people just don't survive, or their body is damaged in the process that they don't recover. They have a disability as a result. So I really encourage people to look for things that have some evidence behind them about whether they work or not. That's where you're going to be more successful in spending your money well. And I just, we actually have many pharmaceuticals out there that began as a natural remedy, but they studied them, they figured out what component worked the best, they purified it, and now we know when you buy this medicine, because it falls under the regulation of the FDA, it's going to have what it says on the label. Some of the herbal medicines, you can do studies on them, and they can have a lot less than what they say is in the capsule, or they could have a lot more, or they might not even have that thing at all. So the natural remedies are not overseen by the FDA. If they find out something's dangerous, then they'll try to warn people, but it doesn't have the same quality requirements that the drugs that you get from the pharmacy have. Yes?
Two things. One thing that really helped me, and I still do take it, is Manuka honey, coming from New Zealand, and I know it's expensive, but it does help boost your immunity.
Yeah.
The second thing, what help is there out there for people with long COVID here in America?
So there's two questions. She's talking about Manuka honey that she gets from New Zealand, and it's very possible, it works very well. For some people, it's like some illnesses, people will get well on their own, and it's hard to tell whether what they took affected it or not. That's why you need controlled trials to compare the groups. The other thing is what resources are available for long COVID. There are more and more resources being available for long COVID. I do not know what we have available locally. I think talking with your doctors about long COVID, because the American College of Physicians, which is the internal medicine doctors, the American Academy of Family Physicians, they are learning and setting up things. And so they may know what's available locally. UMS, I know they're looking at some things, and so you will just have to work with the system where you are to see what's available. Yes. One more question?
What food or foods have the highest influence on our immune system?
What foods have the highest influence on our immune system? So I'm going to give you some general things. I don't know that I've ever seen foods rated just one over the other. One of the things is that, food, we don't really eat just one food or another. We have a combination of foods in our diet. And it's really the combination that helps people stay healthy. And a diet that has a high level of fruits and vegetables of all different colors, because they all have different components in them, those are going to be most likely to help your immune system because of all the different components that work together. And I do encourage people to try to eat a diet that doesn't have a lot of processed food in them. Overall, we see that people who eat a lot of processed food tend to gain weight. We know that extra weight, and especially for COVID, is unhealthy. Apparently, the virus likes to infect fat cells, so you can get a worse case. So maintaining a normal body weight and eating a variety of fresh fruits and vegetables is really, to me, one of the best strategies for not just the immune system, but your other chronic illnesses as well.